Hello, this is Mayor Deirdre Waterman, and we're here now for another Highlights of Pontiac. This is an update PSA that we're doing about the COVID-19, otherwise known as a coronavirus epidemic that we're experiencing. I have here some guests with me, and I would like to start around the table and introduce them to you. First, we have Pastor William Parker, who is the second vice president of the Oakland County Ministerial Fellowship. Next, I have Mr. Maldonado, who is from St. Joseph Mercy Hospital. Then I have our guest expert here, Dr. Kathy Cantor, who is the Chief Quality Officer from St. Joseph Mercy Hospital. To my left, I have our Deputy Mayor, Jane Bias de Sessa, and our Economic Development Advisor, Matt Gibb. So today I'd like to first update you and read a statement about where we are in the city of Pontiac concerning the COVID-19 emergency. As many of you know, I declared a state of emergency for the city Friday. So far, that means that the senior centers and the youth recreation center are closed for scheduled activities. However, we are working with Meals on Wheels to make sure that we are formalizing a schedule by which attendees at either of the centers can still pick up the meals that are usually provided. And we have posted a schedule for that, and effective today, we began serving the meals. This is posted on our website and throughout the centers, but the meals will be available for pickup at the senior centers between 11:30 and 1 each day, and again at 4 p.m. until 5:30 p.m. And that is both the Bowen Center and the Ruth Peterson Center. At the youth center, the children's or the families will be able to pick up their meals from 3:30 to 5 each day. So we want to make that available to you because we know so many families depend upon the nourishment that this provides for their families. So this will continue. Other city services and facilities will be open and available as usual, with these exceptions. The library has been closed for 2 weeks or until further notice. The court at this time is still working on a regular schedule, but as you know, all these things are a dynamic process and these may change. That is why we're bringing you these regular updates, and everything I'm telling you about here is also posted on the city website and on the city Facebook pages. We know that this is a dynamic process, so we are paying attention to all the health advisories from all levels of government. We are passing on this information to keep the public informed and aware, and are implementing the recommended precautionary procedures as they are developed and announced to us. To that end, we have developed advisory flyers and notices that are posted at all city-owned buildings, and we can also have them delivered to you if you call City Hall 248-758-3000. We're also using all the forms of social media for the city, including the Facebook pages for both the mayor's page, as well as the city page, as well as the youth recreation and the senior center pages. We are also putting these PSAs regularly on our cable channel and the website, so they're available to you by a different media. We will continue to enact the procedures of compliance to prevent spread and lower the risk to employees and the public, and we will continue to update you. As this has been a medical emergency, we thought, in addition to the advisories that are coming from City Hall and our various agencies, that we would also have one of our major hospitals come and talk to you particularly about the medical aspects and what to be concerned about. And I'm so happy Dr. Cantor and St. Joe offered to come and to answer questions that we think may be important to you. So with that, I will again turn to you, Dr. Cantor, for your expertise. I know you've been quite busy these days.
Yes.
And I'd like you to start out first by just telling us what exactly is this coronavirus we've been hearing so much about. otherwise known as COVID-19?
Sure. So coronavirus comes from a large family of viruses that can cause many things, from being no symptoms at all to mild symptoms like the common cold, or to very severe illness like we're seeing with this COVID-19. This is also the same virus that caused the MERS outbreak and the SARS outbreak many years back. So this virus can cause many things. And again, it can be asymptomatic, meaning you have no symptoms, the common cold type of symptoms, or very severe illnesses like pneumonia and life-threatening illnesses.
Okay. So many of us are familiar with flu and cold, and why is this particular epidemic and outbreak so severe and so concerning to us?
Sure. So this outbreak is so severe, it's very highly contagious. So if you're within 3 to 6 feet of someone that is infected, it is transmitted by droplets, so secretion. So if I would sneeze and it can land on the surface, if someone else touches that surface within so many days, they could contract the illness. And so it's very contagious, just like the influenza is. But this is also very contagious. This does have a much higher mortality rate than influenza. So less people may eventually get this illness, because a lot of people get the flu, but this has a much higher mortality rate, and that's why we're seeing the response that we're seeing across the nation and globally.
So who particularly should be concerned when they say the mortality rate affects some levels of the population more than others?
Sure. So the initial numbers are showing us ages 60 years old and older, but also if you have other conditions such as heart conditions, lung conditions, those are the folks that are more apt to have more severe illness. Now there have been cases of people in their 30s, 40s, and 50s having a severe illness with it, but majority of the deaths are happening after age 60 years and up.
Now, how do people know if you have it?
Well, again, that can be difficult, because what we're hearing is that you can have no symptoms, which is, I think, generally what we're seeing probably in a lot of children, no symptoms. But the most common symptoms are fever, cough, and shortness of breath.
Now, if somebody experiences that, what should they do?
So if you have a fever and you're concerned, what I would do is immediately to call your primary care physician. We're asking folks not to go into the office, because just that process alone, should you be positive for any of these things, that you could spread that illness. So we're asking folks to call their primary care physician if it's simply fever or a cough.
Now, what are the other symptoms that are really warning signs that connote a more serious form of the disease?
Great question.
What should they be aware of?
So really it's respiratory symptoms, so breathing difficulties. So certainly that can progress rapidly for some patients. So if you have breathing difficulties, that's certainly something that needs to be escalated, and I recommend calling 911.
Okay. Now, there's a lot of precautionary measures that are being hearing about, and every day we hear more restrictive measures. What is really required right now, and what may be coming in the next few days from what we see now?
Yes. Number one is wash our hands. Wash our hands a lot. And so with that, it's washing with warm water and soap for at least 20 seconds. And then you can use the alcohol-based sanitizers as long as there's 60% alcohol or up. So that's number one, wash your hands. And then avoid touching your face throughout the day, which we all can do. So avoid touching our face. And then disinfect commonly touched surfaces, and that's with the wipes, the Lysol, Clorox, those disinfectants. Avoid large gatherings as well. And I know we're getting more and more restrictions on that, so do our best to avoid large groups of people.
Yeah, the governor has now issued some mandates that we shouldn't assemble in any larger than 50. That may also change.
Yes.
Some states or cities have issued an absolute quarantine. What does quarantine mean? What does isolation mean? And who needs to use those procedures?
Sure. So quarantine generally means that you are self-isolating yourself, whether you become a person of investigation, meaning they think you're high risk, or you've been positive for the illness and been allowed to go home. So quarantine means you self-isolate from everyone, including your family members. Isolation for our purposes means just kind of stay inside. We're asking most families and their families to just stay inside. Don't go to large places.
All right. And who should quarantine themselves, and how do you know that that's something that you should do?
So generally quarantine, that needs to, the recommendation needs to come from a health official. So certainly people that are positive for coronavirus, COVID-19, need to be quarantined for up to 14 days. But if you've had known contact with symptoms, many of those people are being asked by local health officials to quarantine as well. So quarantine is generally something you're going to get recommendation from a health worker or a health official.
So the severity of this disease is the fact that people can be contagious without even having symptoms, making it different than other kinds of flu.
Correct.
So talk a little bit about that, because that means we don't really know who might have some contagion, be shedding virus. Is that correct? And that's why the need to protect yourself in all circumstances.
Correct. And that's where the need comes to for shutting down schools, is that many times in this COVID-19 we're seeing children may be infected, but they're very asymptomatic. So although they don't cause problems amongst each other, but if they bring that home to grandparents or other people with autoimmune or decreased immunity, they're going to get in trouble with that illness, the older population. So we're trying to keep this from spreading and from getting that high curve of infections right away. We want to flatten that curve, if you've heard that term this week.
So what's happening with that curve that we're talking about? It's still going up, and we don't know how long we're going to be under these restrictions. How do we know, and what do we have to tell people about what we can predict or not predict? Yes.
Great question. I think that's probably what's causing a lot of fear, the unknown and the inability to control this. So some of the countries that had major outbreaks, like Italy and Spain, the first week they increased their cases by 10. The second week was by 100. And so that first week for us, it was by 10. And this next week, we're hoping we're not going to see that 100-time increase, but that's what we're trying to avoid, to reduce overexhausting our healthcare facilities.
Okay. So testing has been talked about a lot. Where is St. Joe in terms of testing, and what's the availability of testing now for people who want to know if they have the virus?
Question. Yeah, so testing, I think, is on a lot of folks' mind. Right now, testing mostly limits to hospitals. And so you have to meet a certain criteria to become a person that is considered for testing, because it is so reduced right now, and we don't have the amount of testing we would like. We're trying to maintain those tests for people that are symptomatic or have high risk. So right now, most of the testing is done within the hospital with the state's guidance and the county's guidance. Now that's going to expand, I think, very rapidly, where we will have more testing available to the public. And again, it could change in 2 or 3 days, but right now it's still mostly just the hospital systems.
All right. So there's no places right now where you can come and drive by and get tested, as has been advertised in some other places?
There may be a few out there, and I'm not sure if they're testing versus screening.
Okay.
So at St. Joe's, we will have that capability in the future, but right now we're just doing it mostly through the hospital-based systems.
All right. Tell us something about the services that St. Joe is providing now, and how that has affected your care system over at the hospital.
Sure.
Okay.
I think, number one, just a lot of education with our teams, a lot of education with the nurses, physicians, to understand how this is spread and what we can do to protect ourselves as healthcare providers. But I think number two, with the governor of Michigan coming out with the hospital restrictions for visitors, that's been quite helpful. And I know that's quite inconvenient to families and patients, but really for us as healthcare workers on the front line, it's been extremely helpful for us to know that we're not bringing even more illness into the hospital.
Okay. Is there anything else that you would like our citizens and residents to know to protect themselves and their families about the services and what they should know medically?
Yeah, I think just stay informed, because it is a rapidly changing situation. So in 2 days we can be in a completely different situation. But also, heed the governor's and the mayor's recommendations of staying inside, avoid large groups, and also don't go to work if you're sick. Make sure you call your employer if you're ill.
Yes, we have made that a notice to all our City Hall employees that we want first to have the care of not only the employees but other staff and our residents. So we have told people if they think that they're sick, first contact their healthcare providers. Don't show up for work because we want to protect ourselves, them, as well as our public. The same thing for the public. Please, our offices are open, but we ask you to use caution. If you have symptoms, please contact your healthcare provider before you come to City Hall for business. We will always be available for essential services, so you needn't fear that we will be closed and not be able to provide things that you absolutely need. We will let you know as some of the contingency services and non-essential services are being changed. But as I said, we're always updating the website as well as the precautions and the restrictions as we get them from all the state, the local, and the federal healthcare agencies. With that, I'm going to open the floor to our other attendees here to see if you have a question as well. Okay.
Thank you, Mayor.
Deputy Mayor.
Thank you very much, Doctor, for coming.
Sure, thank you.
I've learned a lot from this short session here. I guess for me, so I am a big supporter of St. Joseph's Hospital and doctors. So if some chance I feel a need to contact my doctor, do I just walk into the emergency room, or do I call, or is there a specific number that St.
Great
Joseph's is giving out?
question. Yeah, that's a great question because we're getting that question a lot. What we're asking folks is if you have a primary care physician or a healthcare provider you've worked with, to call their office first. And they'll be able to give you instructions based on your symptoms and triage you appropriately. And same with the emergency room. If you think you need to go to the emergency room, we're asking folks to call ahead to say, hey, I'm coming in and I've been traveling in X, Y, and Z, and these are my symptoms. So that way we can get our triage plan in place. And that helps us get things done ahead of time before you arrive.
Very good.
Great question.
Thank
Yeah.
you.
Yeah.
Doctor, so we've heard this 14-day rule, so you should isolate yourself or quarantine yourself or whatever the term that you're choosing that day for 14 days. So if someone has done that and they feel very healthy, does that give them the okay to go back to work? Does that give them, how should they feel at that time period?
Sure, another great question, because we're hearing that word quarantine a lot. So the 14 days is really based on the time that the illness can to come up from the time of contact, if that makes any sense. So what we're asking folks to do is say you've been quarantined or isolated for 14 days based on whether it be your travel history or knowing someone that had the virus, is that you contact your employer because they'll probably have some sort of protocol they go through their employee health system. And that's what we're doing at St. Joe's Mercy Oakland, is that you contact the employer and then they'll connect you to employee health and they'll go through a series of questions to say, when was your last fever, any cough, any other symptoms or any other things we should be aware of, and then they'll clear you based on that.
So Dr. Cantor, here in Pontiac, we've got so many great small businesses, particularly those that serve wonderful food, and they're dealing with the public, not just restaurants, but markets and others. And so what are some of the things, or has there been any directives given on how those great businesses can still serve the public and be part of this, great city of Pontiac, but still be cautious?
Absolutely, that's another great question, and that's something I think is on a lot of folks' minds with the new changes, with the restrictions that come out. So certainly just continue to use those precautions, that they are doing some delivery type foods or carry out foods, just washing their hands and make sure they report to their employers any symptoms they have. But maybe think of some other modalities to deliver those great services to our communities. So whether that is carry out or grab and go type meals or delivery type meals would be great.
Pastor Parker, you had a question as well?
Oh, yes, ma'am, I did. Thank you. I just want to say thank you, Mayor, for your leadership during this period of time, in our time. Because historically, Pontiac has always had a three-strand cord model of leadership, where we combine the religious community with the civic leaders and the educational community to make sure that we was reaching all the facets that need to be spoken to and about. So my question is, how can the religious community be supportive of you as we go through this endeavor?
Well, I think that's a question to both of us.
Yes.
Shall I start out? And
Please
what
do.
I want to first say, Pastor Parker, is thank you for being here. And thank you. I just left a meeting with many of the pastors who were gathering together to see how they could be supported to the city, as you always have been. And I thank you for your leadership, for your spiritual leadership, and for your support in carrying on the city as we have progressed. You have been amazing in doing that. And I thank you wholeheartedly. One of the things you can help is, we know there's a lot of anxiety amongst our public out there. They're getting information from all over. It's changing daily. This virus is particularly contagious and particularly difficult. The mortality rate is higher, and I'm sensing a lot of fear. And that's one of the reasons we wanted to have this particular PSA from a medical expert, so if people could hear exactly the truth about certain things and not depend on what they heard from the internet, which is sometimes can be kind of confusing. So to the extent that you are providing that spiritual leadership and calm to people at this time is certainly most helpful for what we're trying to do and also trying to get out the information. So I thank you for that. I know a number of the pastors also have feeding programs for our residents and guests, and are continuing to do that. So I thank you for that as well. How may you suggest that they
Yes.
could also help?
I was going to
The rest
echo
of the community,
your
yes.
on the fear. So I think your community is very large part of help reducing that fear, and then giving them the source of information and just providing the calmness. That it's really stay calm and don't panic, and reach out for information and resources during this tough time, for sure.
Speaking of resources, are there other resources that you would like to make the public
There
know
are.
about? Yes.
So we have a website. It's stjoeshealth.org. So we will be updating that. And again, the information is changing rapidly. So that's a great source for local residents. But also the CDC website is also
Yes.
very good information. But again, what you read today may change tomorrow. So making sure you're educating yourself and updating daily.
Yes, and we have culled the best of that information from the CDC, the local health department, which is also on the city website. So with so much stuff on the internet and the social media, so many conflicting viewpoints, and we just wanted to make sure that people knew where to go to find reliable, medically sufficient kind of information. And with that, I thank you so very much
thanks
for
for
coming.
having me.
This
Thank
is,
you.
I think, very helpful for us. Thank you to St. Joe, which has always been a partner with the city of Pontiac. We've reached out to them for a number of sponsorships, and St. Joe has always been here and present, and we're very proud of the fact that we have it as a major institution right on our Diamond Corridor here in the heart of Pontiac, right at our woodward entrance to the city. In addition to that, the state of emergency, as we have said, was called for the city of Pontiac as well as for the state and the federal government. One of the attributes of having a state of emergency in the city is that this makes our residents and businesses eligible should there be incentives and other support that comes from the federal and local or county government. Right now, the federal government is contemplating small business support for businesses that are affected adversely by this emergency, as well as providing leave and sick pay for those who have either a sickness from the coronavirus or from their family members that they have to care for. So we are waiting to see how that plays out in Congress, and will, in the meantime, be in touch with our businesses. Let us know how we can support you in this time. And one of the ways we do that is by getting you the information and making sure you have those resources available as they become finalized. And with that, I thank you, Pontiac, for being here in this fine city. Stay well, follow the advisories, and we'll get through this together. Good day.